Thank you, Presiding Officer. For most people across Scotland, the first point of call when it comes to their health is their GP. General practitioners are very much at the front line of our NHS. Without functioning GP services, our health system would collapse. In some areas of Scotland, GPs are closing their doors, they're handing back their contracts, thousands of patients are being left without a GP. In other areas, lists are closed to new patients and practices are simply unable to cope with the volume of patients they have and unable to fill vacancies as GPs retire. I have letters from GPs from Lothian, Aberdeenshire, from a medical practice in Falkirk, which is struggling to survive. The Scottish Government must act to address the looming crisis in primary care, or more patients will struggle to get the help they need. Now, let me illustrate that with some of the facts. GPs are seeing 500,000 people a week. That is a lot higher than before the pandemic. Most of them are working additional hours to try to meet demand. Many of them can only provide emergency appointments due to short staffing as a result of vacancies or illness. A recent BMA survey shows that 81% of GP practices said that demand exceeded capacity. 34% reported GP vacancies, and they estimate that there are about 1,000 GPs short just now. The Royal College of General Practitioners say that there is a need for even more GPs by 2027. There is, although that, a lack of clarity about GP numbers. The government based numbers on headcount, but the truth is that many GPs work part-time. So the flagship target of 800 GPs is well short of what is actually required. So can I ask the Cabinet Secretary to outline the urgent action he intends to take to improve practice staffing and if he will be transparent about GP numbers? The SNP also make claims about the increase in multidisciplinary teams. That is contradicted by GPs because despite the recruitment activity, the RCN reports that 12% of posts for district nurses are unfilled. And when you consider allied health professionals, 346 physiotherapy places vacant. Faced with these challenges, it is extraordinary that the SNP have cut the health and social care budget by £400 million. £65 million alone from the Primary Care Development Fund and £5 million from the GP Sustainability Fund. And our tone-deaf Health Minister, Humza Yousaf, announces this at the same time as he is telling people to stay away from A&E and go to their GP instead. This is just about the most wrong-headed decision I have seen, cutting resources from GPs when they most need it during a winter crisis. It is breathtaking incompetence on the part of this SNP Health Minister, because GPs are on their knees. And if you fail to address their serious concerns, then more people will end up in already overwhelmed acute services when they could have been dealt with locally in primary care. I urge the Cabinet Secretary, reverse the cuts, listen to the BMA, listen to the Royal College of GPs. They are telling you there is a crisis, so for goodness sake, please act. Perhaps he could use the £20 million earmarked for a referendum for this purpose. It never, Presiding Officer, fails to astonish me that when the nation is focused on the crisis facing our NHS this winter, the SNP are focused on the Constitution. At the start of the week, we had extraordinary revelations that senior NHS executives were discussing the privatisation of our NHS. And the discussion was green-lighted by Caroline Lamb, the most senior civil servant in charge of health in the SNP government. Now, either the Cabinet Secretary knew about this and is complicit, or he didn't, in which case he really isn't trusted to be in charge. Either way, you can usually judge how close to the mark you are by the volume of abuse and aggression by SNP members and supporters, not just on social media, but in this chamber. Because this is a damaging story for the SNP, because what it tells us is that the NHS is not safe in SNP hands. Inside or outside the UK, the SNP, no, I think you should listen to this, inside or outside the UK, the SNP would contemplate a two-tier NHS, where those who can afford to pay will get faster and better treatment, and those who are not wealthy would receive a poorer service from a residualised NHS. But, you know, the SNP are already presiding over a two-tier system. More and more people are paying for private consultations, diagnostics and operations. There are some 700,000 people on waiting lists, the 1 in 7 Scots that are being failed by the SNP and by Humza Yousaf. The minutes were also interesting in confirming what we already know. The Cabinet Secretary doesn't listen. He doesn't listen to clinicians, he doesn't listen to civil servants, he is paralysed and doesn't make decisions. People across the NHS have lost confidence in him. And as for the £1 billion black hole in the NHS budget, look no further than Nicola Sturgeon, because when she was Health Minister, she failed to pass on funding from the Labour UK government to the health budget. Presiding Officer, let me finish by giving the Chamber 2 quotes. The first from the Scotsman leader yesterday. Whether or not this was part of a brainstorming exercise, it is deeply concerning it has come to this, and they are right. And finally, Presiding Officer, from Neil Mackay writing in the Herald, if the NHS is a benchmark, then the SNP is unfit for government. Damning words indeed. This Cabinet Secretary is unfit for office, the SNP is unfit for government, and Humza Yousaf should do the right thing and resign. I move the motion in my name.
Thank you, Ms Bailey. I now call on Humza Yousaf to speak to move Amendment 6899.2.